Have you had stem cell injections and you're wondering, what does the rehab process look like? And even worse, where does it go wrong so it doesn't happen to you? That's what I'm going to be covering inside this video. My name is Dr. Chris Garcia. I'm a leading expert in stem cell recovery. I'm excited to help you enjoy your recovery process without any hiccups. Now, there's several reasons where rehab goes wrong, but today I'm going to focus on the #1 primary challenge that people just like you face or will face in the future. Now, if you're looking to avoid those, you're in the right place. As we look at the spectrum of stem cell recovery, people think typically that they go nice and easy, they manage it on their own, and they just increase activity or decrease activity based on how they feel. Now, this is the absolute worst approach that you can do in your stem cell recovery process. Let me outline what a proper recovery process would look like, and I can show you exactly where you might have a flare-up or any issues in your rehab process. All right, from 0 to 2 weeks, after injections, this is where you're just not doing much. You're doing your daily activities. You're not even starting the physical therapy process. From weeks 2 to 6, this is where you're really starting that process with your physical therapist, and you are going to work purely on motion and mobility. You're not even doing body weight exercises. From weeks 6 through 10 is where you're going to start those resistance body weight exercises, and this allows you an opportunity to start really seeing how you're feeling. Now, this puts you around the 10 to 12 week mark. At that point, then you will start going to the gym and getting in basic functional activities, having more resistance training, and that'll last for the next 4 weeks. This puts you at that 4 month mark now, and this is when you start getting into the things that you loved, a small integration. Maybe you enjoyed running, maybe you enjoyed tennis. This is that gentle introduction, and at the 5 month mark, you start practicing and getting out there more often. And at that 6 month mark is where you're really feeling 70 to 80, maybe even 90% better. Now, where does the rehab process go wrong? The rehab process goes wrong at the most vulnerable times, which is the transition point between phases of rehabilitation. For instance, 0 to 2 week mark, I mentioned that at the 2 week mark is when you start to introduce more motion and mobility. At the 2 week mark is where flare-ups or issues happen. So if that transition point with the rehab process is not slow, gradual, and seamless, you're going to have issues at week 2 after injections. The next one is going to be at the 6 week mark. At the 6 week mark is where you transition from motion and mobility to more body weight exercises. So we said at the 2 week mark and at the 6 week mark. Next, at the 12 week mark is when you transition into more body weight resistance and more activities into the gym. That's at the 12 week mark. So far we have 2, 6, and 12. After that is now when you're getting into functional activities at the 16 week mark, because that's when you slowly start to introduce maybe some gentle pickleball, gentle things that you've enjoyed. And then at the 5 month mark, you're transitioning more into those activities. So your critical time points where rehab goes wrong is at weeks 2, 6, 12, 16, 20, and 24. Now, if you are working with a specialized physical therapist, a stem cell recovery expert is what we call them, they'll help guide you through these processes, because your body's ready to tolerate more, but you might not know how much. And these people are specialized and they understand these critical time points to make sure that you are healthy, happy, and without any form of flare-ups. So where does the rehab process go wrong? At every single transition point, when you start to challenge the body just a little bit more. And if you're concerned that you don't have anyone who knows this process, who knows these timelines, you're more than likely going to have issues with your recovery process, and more importantly, you won't maximize your outcome. So if you feel stuck or lost and you're looking for support or answers on what's the next best step for me, so whether you're 6 months out, 3 months out, or you're considering your stem cell injections, it's good for you to know these time points. And if you need support of any type, feel free to reach out to my team so we can help with a consultation to point you in that right direction. There's no need to feel lost. All of these time points are very predictable, and your rehab process is only going to go wrong is if you don't know what those milestones are. So I hope this helps along your rehab process and points you in the direction to be happy, healthy, and without any flare-ups during your rehab process. Enjoy. Hi, if you found this video helpful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for my weekly tips on recovering safely to create long-lasting results after stem cell therapy. Thanks, and I'll see you soon.